Hey guys, welcome back to another video from the Aspiring Medics. My name is Yusuf, and in this video we're going to be talking about motivation for medicine. It's a really important topic to know about for your medical school interviews, so expect to learn how you can give a model answer for reasons why you do want to go into medicine, as well as how you can give realistic answers for what you might not like about medicine. If you're new here, don't forget to like, comment and subscribe. We hope you enjoy. Medical training is long and being a doctor can be stressful. Some doctors who qualify never practice. What makes you think you will stick to it?
Okay, so medicine is an incredibly long process. So we can have up to 6 years of training from medical school, then there's the 2 foundation years before we even transition onto specialty training, which can even take up to a further 10 years depending on the specialty. And alongside all of this, these many years, there is a lot of stress placed on an individual. There is higher workloads, there is unsociable working hours, and lots of other kind of emotional stress being placed on somebody that goes through medical training, which I don't think should be underestimated. So for myself to really get a taste and see whether I thought medicine was for me, I organised a work experience placement on our cardiology ward in a hospital. Now from there I saw that particularly for the junior doctors, a lot of stress was placed onto them with the amount of patients that they had to see. I also tried to speak to a variety of different doctors ranging from consultants to the junior doctors to understand kind of what they think about medicine, whether they enjoy it, and what sort of coping mechanisms they have for the stress. So for example, a consultant that I spoke to really recommended having some kind of release that's separate from your workload of being in the hospital, and he was really into running. And for me, I play a lot of netball, and I really find that's a release from my current work studies. Spending time with different people outside of a healthcare setting that have different interests, it really helps me still keep the enjoyment of my work studies, which I think would be something really good to put in place for becoming a medic. But also from my work experience placement at the hospital, I also had a work experience placement at the GP surgery, which gives a completely different side of medicine. And I really think that sort of career would be for me. With the intellectual curiosity that I saw such a wide variety of illnesses that I'd never come across before, and I really enjoyed going and researching about them. And I really like the blend of patient interaction and intellectual curiosity that comes with medicine. And so I've really try to understand the whole picture of medicine going through our training and how long it can be, but at the end of the day I really think it is a career that is best suited to my personality in terms of kind of the sociable aspect of interacting with so many different types of people whilst also having intellectual kind of stimulation. So I think that personally, from my experiences from talking to people and also my extracurriculars and what I'm interested in, that I believe that I would love to study medicine and continue with it for the rest of my life.
What do you think a doctor entails apart from treating patients?
So from my volunteering at my local GP surgery, I really understood the whole kind of package that a doctor can offer to a patient apart from just treating, from making them feel comfortable, from the diagnosis to the prognosis to the lifestyle advice, and kind of just overall patient interaction is not just limited to the treatment. From some of the examples of the best doctors that I saw were the people that really put an emphasis on patients' feelings and making them feel most comfortable. But also a completely different aspect, which I think is underestimated in medicine, is the wide variety of roles that you can play as a doctor. So, for example, at the GP surgery that I was volunteering at, one of the GPs was the partner. So that is a more managerial type role that they played alongside their normal GP day-to-day work. And I really enjoy managerial roles. For example, I am the netball captain of my local team, and I really enjoy bringing everyone together within a team, whether that be the attack and the defense, and making sure everything runs smoothly. And I saw that happen particularly at this GP surgery, that whilst they were still doing their day-to-day doctor care, the managerial role of organising receptionists with the nurses, with the physiotherapists, and ensuring that all patients had the best care. I've also seen, for example, at the hospital when I did my work experience, the more academic and teaching roles that doctors can take on, particularly for those doctors that are in their younger years or even at medical school. So those who have more experience often give teaching sessions and tutoring and support, and I really enjoyed this aspect of medicine. I think watching the elders and the people with the most experience like kind of pass down their advice really brought a togetherness within the whole team at the hospital. And I personally really enjoyed tutoring. At my school, we have a peer tutoring program where when I was in year 11, I was partnered with a new year 7 that had come into the school and offering them advice on which are the best ways to get to lessons, and helping with reading and homework and things like that. I really enjoyed it, and so I like the overall kind of wide variety that we can have in medicine, that's not just limited to treating patients, but it's to an overall patient experience and also overall team experience within a multidisciplinary team.
What do you think will be the most difficult things you might encounter during your training? How will you deal with them?
Okay, so I think one of the main difficulties that I would encounter as a medical student, and even passed into like my medical career, is the workload. I think it's not something that we particularly can prepare for at school. The unsociable hours of the possibly working night shifts, and the differences between, particularly at medical school, other students who may only have 5 to 6 contact hours a week, versus in medicine we can have up to 15 to 20 hours. I think learning to deal with that workload and how we might have to change our lifestyle around that is something that can be very difficult to adjust to at first. And this is kind of a pattern that continues into the medical career. Once you graduate medical school, in that foundation year, doctors in particular are often given lots of workloads, who work long hours and are not necessarily in the strict routine that most people are in. And I think that can really place a kind of strain on your relationships with other people who may not be in similar circumstances. And so to try and prepare myself for the increased amounts of workload, I've done quite a lot of things to kind of prepare myself and liken myself to if I was a doctor. So for example, alongside my work studies and my A-levels at school, I also have a part-time job at my local shop. I also still continue with my volunteering, and I also carry on with all of my sports. And I think whilst these are not things that I have to do, they are all things that I enjoy doing, and it means that a lot of my time it's very busy and I have to work on my priorities and really be able to focus when things need to get done. And I think that's a really good way of kind of preparing myself as much as I can for the stresses of medicine at medical school, but also going through into life as a doctor. I've spoken to doctors about these kind of things. You know, I witnessed junior doctors when I was doing my work experience placement on a cardiology ward really struggling with the amounts of patients that they had to deal with due to understaffing, and that's what is a very real scenario, which is, I'm sure, is going to happen if I was to become a doctor. And they really gave me advice on ensuring that you have your kind of separation between your work life and your home life and what you enjoy. So for example, he really recommended kind of mindfulness and yoga and meditation to really allow yourself to separate your workload stress from your home life, to kind of encourage you with your motivation and to really keep up the energy that is required for such a high workload. So I think taking on that advice from the doctor and really practicing as much as I can with making sure I'm busy while still keeping my academic studies the main focus and still enjoying it, that I'm better prepared to deal with the overwhelming workload that can be associated with medicine.
Discuss your involvement in extracurricular activities that demonstrate your interest in medicine.
Okay, so I think there are 3 aspects of medicine that I really enjoy and that I've tried to kind of replicate through my extracurricular activities, which is emotional satisfaction, intellectual curiosity, but also working with a diverse range of people. So for the kind of emotional aspect of medicine, I volunteered for a local charity which aims to help young children in the area who have disabilities, which might mean they struggle to make friendships and connections with people of a similar age. And so I worked with a certain teenager who was non-verbal and had quadriplegic cerebral palsy. And at first I really found it difficult to communicate because I'd never come across that kind of scenario, and I really struggled with making her feel comfortable and really try and open up with me. And over time, and learning how to modify my communication to allow her to feel more comfortable. And towards the end of my volunteering kind of placement, over a year and a half, we really had built an incredible bond, and we'd seen her flourish in terms of writing and in terms of communication with people that we'd never seen. And it really showed me how much of an impact you can have on individuals who necessarily people haven't tried before. And I think it really helped me know that medicine is the sort of job that I would really like, because interactions with such a wide range of people who you don't know their backstory, and you want to try and help as much as you can. And in terms of intellectual curiosity, I got a work experience placement at AstraZeneca, because one of the main AstraZeneca sites is in my local town. And it really showed me a completely different side to medicine in terms of drug development, pharmaceuticals, and how kind of access to drugs can impact patients, and the wide variety of illnesses and how we're trying to combat them with pharmaceutical interventions. And it really particularly stimulated my intellectual curiosity that is leading me to apply onto a course like Oxford, which particularly focuses on preclinical and really understanding the science behind all of our clinical decision makings. So I really enjoyed that. And I think both of these placements overall has led me to interact with such a wide variety and wide diverse people that I think a doctor and doing medicine, it's really key, because you are interacting with a multidisciplinary team who are involved in lots of different specialities and different kind of intellectual curiosities, such as dietitians, physiotherapists and things like that, but also really reconfirmed to me the how much I really enjoy interacting with such a wide variety of people and how much a positive impact you can make on people.
Which area of medicine are you most interested in, and why?
Okay, so at the moment, netball is a huge part of my life. I train with a very competitive team, and I really enjoy the kind of social and the team building aspect of it. And a key issue that I've seen across netball has been ACL injuries, and that really stimulated my interest into sports medicine. There was a particular pattern of a lot of young, high-performance athletes having a really high amount of ACL injuries. For example, in my squad of 15, 3 people actually ended up having ACL injuries across 2 years, which is a really high amount. And so I really started looking at sports medicine. I really like the lifestyle aspect, the treatment aspect, but also kind of the application to a non-clinical scenario in terms of high performance athletes away from hospital. So I actually shadowed one of the team doctors and the team physiotherapists that are associated with the elite netball team, and I really enjoyed it. But I also understand that I haven't actually experienced that all of the specialities. I do not know all of the specialities that are out there, so I really try and keep an open mind, and I think that's why applying to Oxford, because I know that they offer an intercalated year. Now at the moment I think I would be really interested in looking at some kind of ACL study and kind of more epidemiology based medicine, and looking at why injuries happen in certain cohorts and what preventative aspects we can put in that place. But I also appreciate that I haven't done a lot of preclinical science, and I might have another interest when I get to medical school and when I experience lots of different things. So whilst at the moment I think sports medicine would be the specialty for me, maybe when I'm on my clinical placements I might enjoy more of a hospital-based kind of speciality, and so I'm trying to keep a very open mind with it. But yes.
Why are doctors leaving the NHS?
So I've actually read that I think around 140,000 NHS workers leave every single year, and I think that's got to do with the incredibly high workload, the burnout, the stress, the kind of inflexibility that's associated with medicine, such as, you know, only 6-week rotas being handed out in advance. It's really hard to know whether you're going to be working the night shifts or the day shifts. And things like that really mean that medicine can be a difficult lifestyle to kind of maintain, especially building relationships and connections with friends and family who might not necessarily understand this kind of aspect. And I've spoken to lots of doctors when I was on my volunteering placements about these kinds of things. And they really appreciate the difficulties. But for me, I think the aspect of medicine of intellectual curiosity and kind of the emotional connections and the impact that you can make on a patient's life is you really can't replicate in other jobs. Some doctors are leaving for, you know, to work abroad where they might earn more money and they might work less shifts. But for me, the NHS is an incredible thing. It is free healthcare to all, that is accessible to all. And I think it's a really special system that we have here in the UK. And I would really like to be a part of that. And I've tried to become exposed to the workload difficulties that is associated with medicine, but it has not made me lose my passion despite doing kind of 24-month placements, volunteering in a hospital and really witnessing this on a weekly basis. Undeniably, I think this is my passion, and I really think that overall the kind of satisfaction from helping patients outweighs the stress and the kind of understaffing that people are currently facing in the NHS.
Which aspect of medicine do you not like?
I think the workload that is particularly associated with becoming a doctor in the NHS is the aspect that I think is most unlikable to me. So from witnessing on my own work experience placements, the high intensity workload and the long hours that is associated with becoming a doctor, whether that be a junior doctor or a consultant, but also medical school. Medical school is a long period of time and can be up to 6 years and has a high workload, often in comparison to your other peers. However, I've been trying to build coping mechanisms that I think would best set me up to deal with this workload. For example, I really practice mindfulness and kind of yoga each morning when I wake up and before I go to bed. So it really, for me, resets myself. I'm ready for the day and I'm ready to deal with whatever comes with the day, but also before I go to sleep to ensure that I have a clean sleep, healthy sleep, and I'm really, again, ready for the next day. So breathing techniques for me have really helped, in kind of visualization techniques. And so I think things like that on a more practical way are going to help me deal with workload. But I also think it's something that comes with experience. You know, we're not just thrown straight into it as a medical student. You start off and you build up the workload. And I think this kind of progression, whilst it might seem really harsh to me right now watching a junior doctor on a ward, because it's not something that I'm used to, that hopefully in the years and the time to come that it's something that I would be prepared for, and medicine is a job that I would really love to do. And so I think always would try and come up with reasons to try and minimise the stress that is associated with the workload in medicine.
What would you do if you were not offered a place to study medicine?
Medical school is really competitive to get into, and I understand that I may not be successful in gaining a place this year. However, medicine for me combines everything that I think I would want out of a job, and I think combines the best aspects of my personality. So I would take a year out to reapply and prepare myself better for the applications. So in particular, I think I need to work on my verbal communication skills. So I think I would practice maybe with tutoring, expanding tutoring and kind of offering help to younger students so that I can learn to adapt my verbal communication and to really improve on it. In terms of when talking to other people and to really help gain my confidence. I also really enjoy the clinical aspect of medicine, and since I will be turning 18, I think I will try and get a job as a HCA, a healthcare assistant in the hospital, so that I really understand what it's like to be in clinical situations, to get myself exposure to kind of clinical observations in terms of taking blood pressures and understanding how medicines are often delivered. And I'd also like to get more experience and more kind of insight into medicine through different work experience places. So far I've done a GP placement and a cardiology placement, but I also think I'd really like to look at, say, an aspect like pediatrics to really show the wide variety of medicine and to try and see what interests me the most. You know, I really think that medicine is for me, and so I'd really enjoy looking at all the different kind of departments and different jobs that you can go into as much as I can to see what I enjoy the most so that I can become more prepared, ready for when it comes to interviews next year.
Do you think doctors should set a good example to their patients in their own lives? How or why might this be difficult?
Okay, so one of the GMC duties of a doctor is to always respect patients. And I think to respect patients, we should always set the best example. So as doctors, we often can give out lifestyle advice such as smoking, because we understand the effects of smoking and the links with cancer and lung diseases, alcohol intake. We also try and encourage healthy eating habits and exercise habits, and also a big one is sleep, ensuring that people are having lots of sleep and clean sleep in a regular pattern. Now, obviously as a doctor, that can be difficult sometimes with the nature of the job of working night shifts and working long hours. And even though I think doctors would try their hardest to always set the best example and the best kind of lifestyle examples, that sometimes the constraints of the job means that they're not always getting the best sleep. So I think sleep might be a difficult one to kind of keep. But I definitely think that the ideas of exercise and clean eating are something that a doctor should always try and maintain in their own life. But it's also understanding that doctors are humans, and that whilst it's so important that they have respect for the patients and they try and act in the best way all the time, they are humans who need their release and have their own social and private lives, and whether that is always going to set the best example. For example, you know, like a works Christmas party that might have as doctors together. They might drink alcohol, they might stay up later than they should. But in order, I think, for doctors to kind of maintain such high workload successfully and efficiently and offering the best patient care, that sometimes these releases are needed. And I think another aspect that we will kind of encounter, particularly in these next future years, which might not have happened in the past, is kind of this age of social media. Now, social media is very accessible to people now, in particular patients. So patients can come across doctors' social medias, and whilst doctors are entitled to a private life, I think it's really important for people to understand that what they are posting online can be accessible to patients. And in order to build trust with a patient and for them to really take on the advice that you're giving them, I think it's really important to show that you're following your own advice. And also there's kind of the age of YouTube doctors and things like that. A very popular one is Dr. Mike. And I think quite often it can blur the boundaries between professional working life and kind of your home life, which can become difficult for setting great examples all of the time, and clips that can be taken out of context and things like that. I think it will become more and more difficult for doctors to maintain this kind of clean and always setting the best example. But overall, I think it's really important that doctors should be able to set the right example for patients. I don't think it should be difficult, because if you're giving out this advice, then you should be following it yourself because you want to live the healthiest life. But also understand that in future kind of difficulties surrounding social media may start to become a problem, especially when understanding that doctors are human as well and they have their own lives outside of medicine.
What is the importance of lifelong commitment, and how does lifelong learning relate to medicine?
So medicine as a career is a lifelong commitment. The learning never stops, whether that's from the second that you step into medical school to the day that you retire. So as we can see, medicine is continually evolving. For example, you know, people that were doctors, that are currently doctors now, that are say in their 50s, when they were at medical school, some of our really founding principles of pharmaceuticals and kind of the way that we treat patients is based on things that weren't even discovered until they were maybe in their 30s. And so we continually have to stay updated with the current research, with the updates to guidelines, with the kind of changing interactions and the different specialities that we can have with patients. So the learning journey doesn't stop when you finish medical school. And so I think it's really important to prepare yourself when you're applying to medical school for this lifelong commitment. So for me, I always have tried to replicate this by making sure I'm always on top of my academic studies, but also reading further into the syllabus and reading further into my interests that's separate from what we're being taught from school, to kind of ensure that my commitment is gonna stay strong throughout it, even when I'm going through a particularly rough patch at school, you know, some of those chemistry topics I don't particularly like, but I still want to do extra reading on it and make sure that I fully understand it to ensure that I can always do the best. But I also think as well, showing that you can have all of these lifelong commitments and everything, but I still really enjoy it. And it's still something that I want to do. And I actually really quite like the busy aspect that is associated with medicine. So right now I volunteer for a local charity, but I also still do my volunteering at the hospital. I still keep up with my sports and my academics. And these are all really long, time-heavy commitments, but I still really enjoy doing them. And so I think the lifestyle that is associated with medicine and this lifelong kind of journey is something that really appeals to me, and it's something that excites me. You know, medicine is, there's endless possibilities of things that we can research and that we can discover, and medicine can look completely different in 10 years time, never mind in 30 years time, which could be, you know, when you start medical school to when you become a consultant. So I think it's something to kind of be embraced.
Okay guys, thanks so much for watching all the way to the end. We hope you found it useful. If you have, please do subscribe and leave a like and let us know what other medical school interview questions you'd like us to cover next. Alright guys, see you in the next one.